Hi guys, it's Jazz Gulati here, and in this video, I'm going to be reviewing the Bruxchecker foil as part of parafunctional analysis for patients. I'm going to dedicate this video to the DPR Facebook group, which stands for Dental Product Review, and this group is, I think, mostly Australian dentists, but it's an opportunity to sort of review dental products in our industry from dentists and share it with our colleagues. So I first learned about the Bruxchecker through a physio, a TMJ physio called Krina Panchal on her Instagram channel. Do follow Krina, and I thought this was fascinating. I'd actually never heard of the Bruxchecker before, so I called up my lab and said, hey, can you guys make me a Bruxchecker? And they're like, what the hell is that, right? So I went and bought my own Bruxchecker, but then because I didn't have like one of those mini star machines, I sent it to my lab and they started to make my first few Bruxcheckers for myself, my nurse, and then eventually my patients. So I'm going to share with you what I found useful and where the indications of a Bruxchecker might lie. In a nutshell, imagine a thin Essex retainer, like a really thin Essex retainer, kind of like a foil. Now imagine it's got a red dye on it, which it has, and basically your patient, when they parafunction, they will wipe away that red dye. So it's a way of doing parafunctional analysis. It was developed by someone called Professor Sato in Japan, and it's made by Scheu Dental. It's basically a way to visualize grinding patterns. Now remember that bruxism is not a disorder, it's a behavior, but sometimes bruxism can have negative consequences on our patients. Therefore, it's a clever way to check exactly what is their occluding scheme while they parafunction. So like with all occlusal appliances that I try myself, I want to get my hands on my own Bruxchecker, try it for myself, because basically I want to see, is it like too easy to wipe away? Is the dye too sensitive? So I checked it with a probe, and you needed a fair bit of force and something sharp to wipe it away. But I made it for myself, and what I did was I checked it on just inserting and removing, make sure my tongue didn't rub away any of the dye, because that'd be rubbish. I then checked it on just gently tapping my teeth, just bringing my teeth together very gently to see if that would wipe away anything significant. And it wasn't too bad, actually. It was a very tiny mark and nothing too significant. I then tried it by clenching really hard on it. Initially clenching gently and then clenching very hard, and I could see the progression of how the dye was being wiped away. And it's mostly posterior because I know my bite and I don't have much anterior guidance. I then checked it on grinding gently and then grinding very hard, all while consciously awake, obviously, as I did in front of the camera now. And then I wore it overnight. And when I wore it overnight, I managed to sort of appreciate my bruxism or parafunctional pattern while I'm sleeping. So I'll play the next video of me comparing my daytime clenching on the Bruxchecker versus my nighttime parafunction. But check out what happens when I wore it for one night while sleeping. So I managed it in the whole night. And look at that. So can we see the canines and a little bit on the lateral as well, as we can see. And I think the contact actually is more distal as well on the distal half of that molar compared to while I was consciously grinding. This is what I can get. So I'm obviously protruding and going left and right as well. So once again, let's compare that. We are voluntary daytime mimicking parafunction just to test out the dye. Even look at the premolar. And then this is the parafunctional path. So I started using this on patients with some success, and I think I can think of three main reasons why I'll probably continue to use the Bruxchecker. This is not a sponsored video, by the way. I'm just speaking about a product that I like. Number one is to check your patient's parafunction path. So without giving them an appliance straight away, we just want to assess what is their parafunctional path, because their parafunctional path will remain the same after you rehabilitate them. So it's a good way to check that. It's also fantastic for co-diagnosis. Like we have so many patients who don't accept the fact that they may have a parafunctional issue while they sleep. So this can actually show them quite clearly. So it's great for co-diagnosis. And the third time I might use it is after you've done a rehabilitation or some restorations and you've dialed in your, canine guidance and posterior disclusion, all that kind of stuff, you want to now do a control. So you send them home with their rehabilitation to check when they're parafunctioning at night, are they actually producing the occlusal scheme or the occluding scheme that you hope they would do, and the same one that you analyze during the day in the chair? Because what's important, right? It's important what they do in the chair, but it's even more important, in my opinion, what they're doing in their sleep. Because during those harmful parafunctional forces, are they potentially going to be putting your restorations at risk? So I think it's a great way to control after doing a rehabilitation. So I'm just going to finish up this quick video now with what my nurse thought of this when I gave her the Bruxchecker to see how she got on with it. So you'll see how powerful it can be for co-diagnosis. And then that's this video over. I hope you enjoyed this review of Bruxchecker. I like it quite a lot at the moment. If you enjoyed this video, make sure you hit subscribe and I'll catch you in the next one. So let's listen to what Zoe had to say. See that lovely pattern that you made. Tell us about how it was wearing it. Was it difficult to wear or how was it?
It was okay to wear. The left-hand side was perfect, didn't even know it was there. The right-hand side feels like it wasn't quite against the gum on the palatal side.
But were you able to wear it and sleep comfortably enough with it?
Yeah, I slept for about 6 hours with it and then got fed up with it after that.
Fine, so you slept for 6 hours and you took it off. I appreciate your honesty. But you managed to get sleep and it wasn't too... You weren't thinking about it the whole time?
No, it was a bit to begin with, but not really.
Okay, and then what were your initial thoughts when you woke up and you removed... Were you able to figure out what happened once you removed it and saw it, or...?
Yes.
Okay.
Yeah.
And was it even more clear when you put it back on the model?
Yes, yeah.
So tell us, what were you thinking when you saw that?
Well, I woke up clenching the teeth anyway, so I knew I'd been clenching. And obviously, looking at the model, I realised it had been grinding as well.
Mm-hmm. So the way we figured out if you've been
more
grinding...
than I thought.
Yeah, more than you thought. The way we figured out if you're grinding, I'll just put them together for me. There, on the canine. So if you slide your lower jaw towards the right a little bit, that's it. You see that mark there?
Yeah.
That forms from grinding, okay? So if you can remove that lower model now, so have a look at the top. So some of it is clenching, I imagine that one as well, but it's usually in tandem with grinding as well. And that premolar on the left as well. Let me just let that focus now. There. So it's more than you thought.
Mm-hmm.
Right, so has that convinced you that you're a grinder and we might need to make you a guard?
Yes.